Welcome back to the podcast, and I'm back with my friend Dr. Jud Brewer. How are you today?
I'm good. Good to see you.
Good to see you too. This one is going to be really fun because honestly, as I'm reading this article, we're going to talk about your article here in a second, but as I'm reading your article, I'm actually doing what you said to do in this article. But it's the article is the simple eye trick that can instantly shift you out of anxiety. We'll put a link in the bio below, you guys. It's really fun. I'm really going to be practicing it all day long. But let's talk about, can you tell us a little bit about this and how you came across it?
Yeah, the history, I don't know exactly where this came about in terms of me just exploring it clinically, but I started noticing how, well, one, I probably has an origin in curiosity because I love curiosity as a superpower. And you and I have talked about that
Yes,
before.
I've stolen
And,
that phrase more than once.
and I've certainly noticed that when my patients are really curious, their eyes do something differently than when they're frustrated or when they're anxious or when they're angry. So I
Mm.
went back and looked at some of the literature, and it turns out actually some researcher that I know, but also a researcher that that's been that's long deceased, Charles Darwin,
Yes.
had kind of pointed some of this out. So I put all of this together
Yep.
in an article, but it actually is very simple. It makes a lot of sense and also fits with things that go way beyond our eyes. So I always like things that are clinically useful that my patients can pick up right away. And this is one of those.
Well, I'll tell you, living in Las Vegas, you caught me when you said, not that I gamble, because that would be a bad situation, but you said professional players know a secret most of us miss. Your eyes give away everything. So, I mean, can you tell us a little bit about what's going on when we widen our eyes and what exactly is occurring?
Yes, and so this is where some of the basic neuroscience comes in. Adam Anderson and some of his colleagues, I think he's up at Toronto or was at the time when he did this study. They basically did a series of studies to see how much basically sclera to iris ratio, like how much of the whites of somebody's eyes, very nice demonstration, when seeing more of this, how much this affects information processing. And the short answer was the more we open our eyes, the more information gets in. And you
Okay.
can think of two very basic scenarios on the opposite end of the emotion spectrum, one being labeled as, well, fear and curiosity, for example, are both situations where we open our eyes really wide. And that the idea here is, think of fear. If we're afraid, it's really important to get in as much information as we can. And with curiosity, it's not like a driven quality to it,
Hmm.
but curiosity is also when we're really interested in something. And so we can naturally open our eyes so that we can take more information in. So Darwin suggested this. He hypothesized that this is an evolutionarily adaptive feature. And then these folks, I think about 10 years ago, did a study showing, where they even narrowed it down, narrowed it down to just showing people's eyes. So they showed faces, like fearful faces and things like this. But then they said, wait a minute, could we just do this sclera, this iris to sclera ratio, and it showed the same thing. So that in
Hmm.
itself is pretty interesting, right?
That is interesting.
Our eyes can be a good tell in terms of when we are taking in information and when we aren't. So curiosity and fear are places where we do take in information. The opposite end of the spectrum, where we're focused on action, is anger, for example,
Hmm.
where anger, it tends to be more focused, where we're like, I know what I'm going to do and I'm going to do it, right? Where
Hmm.
it's focused in a certain direction. And
Right.
so when somebody's angry, they're not actually taking in information. And so if we look, and anybody can do this for themselves, think of a time when you're angry and see what your eyes do. Well, our eyes
Hmm.
tend to be narrowed when we're
Hmm.
angry because we're not trying to take in information. We're focused on action. So we can see the two
Hmm.
ends of the spectrum in terms of when we are eyes wide open, taking in information, and when we're not focused on taking in information, but more on action.
Hmm. So many ways I could go with this. So I'm curious. My eyes are wide open. Um, this is going to get really bad. I can tell the puns are rolling today. Um, when you're actually having a conversation with someone and we respond to those facial expressions, like when they raise their eyebrows and their eyes get bigger, can you also utilize it? Like, let's see that you, beyond the anxiety piece where we raise, we can stop the the use curiosity to kind of bring down the anxiety. But what about if it's really like we want to listen to someone and we want to tune in, or maybe we start feeling some irritation because the waitress is taking forever. Like, can we also use it for like other negative emotions, this positive like effect, do you think?
Oh, I think, well, there are several ways that we can use it. One is these can broadcast information.
Mm,
So think about being in an unsure situation and you look around and there are other people around, and if they have a facial expression of fear, that can actually convey information to us that says,
right.
hey, there could be danger here. You should take in information. So it's actually a very effective tool for, it goes at the speed of light, so to speak. Where as soon
Literally.
as we see somebody's facial expression, we can see, oh, they're afraid. Maybe I should look around and be afraid. And the contrast is also true. When we look around and we see somebody's angry, for example, or frustrated, that also instantly conveys information. So we can actually gather a lot of information from these nonverbal cues, especially with people's facial expressions.
I almost, I hear my dog, she's growling at the door because there's an Amazon guy here. Not my Amazon. Oh no, it's UPS guy. But you see the same thing in animals, right? Because when like when we walk our dog every single morning, if there's other dogs, depending on the dog, sometimes they get very narrow, like their face, you can see their eyes scrunching, or if they're playful. And Daisy, like when you talk to her, she opens her eyes like really interesting. It's really fascinating to think about just the animals and babies and little kids. Um, Really fascinating. There was a book, I can't remember something about oh man, it's gonna bug me. But she was writing a book about how to help people with skills, people skills, so that when there were introverts trying to learn how to be more extrovert. And I was reading it just because I was curious about patient expressions and if I could learn more about like what they're thinking and saying and doing. But it was really fascinating to utilize those skills also. I'm curious in the listening. Do you feel like that would make us like if we're struggling to focus in on someone's like if we open our eyes and we're in the middle of a lecture or we're in this conversation and we're not necessarily wanting to do you feel like that will help bring us in? Like it actually drives a curiosity
I think
button?
it can. And so if we look at this from an emotional contagion standpoint, this
Mm,
is certainly something, I as a clinician and probably you maybe even doing this inherently, when we are truly interested in hearing a patient's story and we're not jumping to a conclusion,
hmm.
right? What do our eyes naturally do? Our eyes open wide, we lean in, and they can take that as a cue that we're truly listening, we're interested. And
Right.
so that can actually open up the interest and the curiosity on their part, where they say, "Oh, they're paying attention, they're interested," and that can actually translate into them being more interested and curious and connected, right? So we see a connection that can naturally form there. The opposite can be true, where if they see that we're narrowing our eyes, they might get the cue that we've already jumped to a conclusion, which
Right.
which isn't
That's
always a
true.
great idea. But both of these transmit that information. And I love the idea of, you know, really practicing checking with ourselves to see,
Mm.
are we truly interested, and even just checking with our eyes for that. So this might get to some of the pragmatic aspects of this as well.
So that just kind of dominoes into mindfulness and understanding the practice of mindfulness. So I always feel like there's more and more we can learn about mindfulness. Can we walk through exactly what mindfulness is? Because some people think it's like meditation, but it's not the same thing. It's just being the present. But can we walk through what that is actually?
Sure. And interestingly, I use that term less and less these days
Really?
because it's a concept that I think, as you're alluding to, can mean different things to different people.
Right.
And if we get at the core elements of what make up mindfulness, it's
Right.
really about, paying attention in the present moment and being curious, bringing this attitude of curiosity. So I go right to those definitional elements where I think if it's, if you ask that question around like, okay, what is curiosity? Well, we kind of know that without even having to define it, which is nice.
Right.
It also decreases the likelihood that somebody's going to misinterpret what we're talking about.
Interesting. So I'm working on an article about procrastination, by the way. Because so many people struggling to get healthy, they procrastinate. Oh, I'll start Monday. Oh, I'll start.
Yeah.
Ugh. Anyway, so I was curious again if, because there's a really interesting article I came across that basically taking procrastination and basically breaking it down into smaller pieces, right? Because you're decreasing your resistance to do something. Could you even use like this type of trick, curiosity, opening the eyes to even start something that you're not looking forward to? Like, does it shift your relationship with something? How would you do that? Like, what would be the mechanism or the procedure necessarily?
Yeah, let's walk through this and we can see how this might apply to procrastination as well. So
Yeah.
what I do clinically is, well, one more piece of background that'll help here. So when we have formed what's called a somatic memory, where we've tied
Mm,
a body position or body posture with an emotion, that's really important to know that those two are correlated, where they're linked. And so when we have so many times, narrowed our eyes when we're angry, when we have so many times, let's say, tend to tense our shoulders up when we're stressed, right? There's a
hmm
somatic memory that we can hold to the point where if somebody just, puts their shoulders to their ears, they might notice that they're starting to feel a little more stressed, right?
Mm,
Because they're holding that's activating a somatic memory where the body says, oh, hunched shoulders is generally when I'm feeling stressed. So my shoulders are
mm,
hunched, maybe I should feel stressed. So that body position feeds back to the brain and the mind where we're starting to link those two. Well, the eyes and the facial expressions are really linked in these somatic memories as well. And we can leverage this. So
mm,
if we notice that, well, we first off, just being aware that curiosity is associated with really wide eyes, wide open eyes, and anger, for example, is associated with narrowed eyes, we can play with this ourselves. So maybe you and I can demonstrate this.
okay.
So the first thing I would say is try to open your eyes. Well, let's start with the narrowed eyes. So narrow your eyes and see how curious you can get with these really narrow eyes. Is it easy?
Mm. No, I'm just focused on your pupils.
Yeah,
Yeah.
yeah, it's tough. So, and now, as a contrast, when you open your eyes really wide and how easy is it to be curious? Oh, it's kind of that natural. So we can
Yep.
see how easy it is to induce curiosity by
Gotcha.
just opening our eyes. And the same is true. Let's take anger, for example. So think of a
Mm,
time when you might have been frustrated with somebody or something recently and narrow your eyes and see how easy it is to feel into that emotion. Is it pretty
mm.
easy to feel into?
Yeah,
Yeah. Okay.
I do.
Now open your eyes really wide and try to get frustrated or angry. Oh, I'm really angry.
It's no, it's like I think there was I read an article once that couples can't stay angry if they're holding hands. It's the
Oh,
same
I
idea.
love it. I love it. Yeah. Yeah. Because
It's
holding
like
hands is, yeah.
I'm
Yeah.
not going to be angry.
So there's a great example of how we can, one, notice what eye positioning is associated with different emotions. And then we can just be checking in with ourselves. Oh, when I'm frustrated, can I open my eyes really wide as a way to pop ourselves out of that? Right.
Mm,
And it's also a great way, even when we're not frustrated or angry or have some eyes narrowed emotion, is we can just be checking our eye position throughout the day to see, oh, how curious am I? And sometimes people say, oh, it's hard to be curious. Well, I say, okay, just open your eyes really wide.
yeah.
And you can even pair that with a vocalization that's also associated with curiosity. My favorite one's, oh,
Yeah. I've heard you
oh,
say "oh" before
yeah, all the
many
time.
times.
Right. And that's very different than, oh no, right? When somebody says, even
Mm,
I do this myself, when I say, oh no, my eyes naturally narrow. Oh no. I was like, oh
mm,
no, what's going to happen? Which
mhm.
is most associated with worry, right? So when we're worried, which is interesting because worry is this brain's trick that it's playing on itself, where it's like, oh, if I worry about this, maybe I'll solve a problem. But when we're
Mm,
worried, our eyes aren't even open to gather information, which is another
right,
confirmation that worry is not a good strategy for
right,
problem solving. It's actually
right.
shown to be anti-problem solving. It shuts down our prefrontal cortex because we're stuck in that loop of worry.
Mm,
So from a pragmatic perspective, it's really helpful just to check in with our eyes as a
mm,
way to help us, pop out of anxiety. And that's why I try not to be hyperbolic in these Substack articles, but it is actually true, and I've seen this enough clinically and in our Going Beyond Anxiety program, where people have practiced this, where it's not like you have to learn to open your eyes really wide. Like we all know how to do that. It's
right.
really a matter of remembering to check to see, oh, when I'm anxious, what are my eyes doing? And then we can go, and when we notice that, oh no, we can go, oh, and we can just exaggerate our eyes and open them really wide, very cartoonish,
Mm,
and see what happens, right? It's hard to be stuck in anxiety, at least for a moment. People might come back and say, well, it comes back. Well, check your eyes, have your eyes
I'm
return to a
back.
normal or even narrowed position. And then we can
Right.
just practice repeating it.
So you can almost feel like you pair that with some deep breathing or something like that to really get that vagal response to calm down, parasympathetic. But I'm curious, do you think this would be cross-cultural? Is the eyes wide open across? Because I was reading, it was a while back about different facial expressions, because I think I was working on drawing different facial expressions, and I got drawn into this research. This happens, this little rabbit holes. But they were talking about what some people thought is anger didn't cross like or happy didn't, work in certain cultures. So I was just curious, you feel like curiosity, that eyes wide open seems to be less a human trait, cross-cultural?
That's a great question. I don't know the answer to that, but I can give
Mm,
you some baseless speculation, a BS
okay.
answer. Okay. So just looking at this Anderson paper, and this is again a single paper done in a Western population, so it may not
Yeah.
translate.
Yeah.
But when they only looked at sclera to iris ratio, right,
Mm,
that is just a simple thing with the eyes. So that's not looking at any of the rest of the facial
the
expression.
continent. Mm,
Right. So we don't even need to necessarily look at the entire, because there may be differences in facial expression across cultures around different emotions. I just don't know the answer to
right.
that.
Right.
But if you zoom in on the eyes, and certainly there can be ethnic differences in eye shape, et cetera, but iris to sclera ratio is pretty universal,
Mm-hmm.
right?
Okay.
Anybody can open their eyes wider than before, or they can narrow
Right.
their eyes, no matter what culture or what eye shape that they have. And
Right.
also, if you look at, the expression comes up, the deer in headlights.
Right.
Right. If you look
Right.
at a deer, they're when you catch them when they're stuck in the headlights, they're frozen. How big are
Right.
their eyes? They're huge.
Right.
And so I mean, this is just anecdata, when meaning
Right.
take it with a huge grain of salt. If you look cross species,
Right.
this might actually be a clue that this is not just a Western culture thing. It may not be just a human thing. It may be in many
Mm,
animals where information gathering is important for all of us,
right.
all animals.
That is really interesting, but I definitely notice it with dogs. Like I've noticed that particular trait. So I'm curious because you also mentioned the somatic memory. I remember when my daughter was applying for medical schools and she was going to her different interviews. I was like, Emily, because I'd read or saw a TED talk, I think, I can't remember the lady's name, where she'd stand like
Oh, the
Superman or
power
Superwoman.
poses.
Yeah, the power poses. And there were some changes hormonally, testosterone, some other things.
Yeah.
Do you feel like this is
That
kind of in
study
that
hasn't
similar?
been replicated, by the way,
Oh, that's a
unfortunately.
bummer.
Yeah.
At least
But
on the hormonal level. But as far as maybe calming the nerves or feeling more confident, I think that might be an interesting thing. Where do you think that lies in that spectrum, or is it even something like even standing in a more confident, like look at yourself in the mirror and go, I got this and I can do this. Does that help, you think? Or where does that sit?
well, if you look at somatic memory,
Yeah.
this could fit with that. I'm not saying that it proves it, but it could
Yeah.
fit. So if people are used to not just doing this themselves, but seeing this culturally, where
Mm.
somebody stands, superheroes tend not to, slink and
Yeah.
close themselves down. They stand, I'm thinking of the Wonder Woman,
Yeah.
if you think of it, she's like got her
Superman.
hands on her hips. She's like, I got this.
Yeah. Yeah. Yeah.
Rosie the Riveter. Remember those
Yep.
World War II
Yep.
posters? Yeah.
Yep.
So those, if you look at that, and if that's been enculturated enough, I could
Mm.
see how that could trigger a somatic memory that says, "Oh, yeah, you can do this too."
Mm-hmm.
The other
Mm.
thing that I would say, and this links up directly with real research, we've done studies looking at contraction versus expansion, close down versus open up. And I think you and I might have talked about this before.
Yeah.
Those power poses are consistent with this more open and expanded viewpoint or experience, and that
Mm.
we have found to be directly linked to people reporting curiosity, kindness, connection. All of those are reported as open,
Yeah.
whereas anxiety, frustration, anger, those are reported as closed. So I think,
Right.
again, indirect evidence, but I think all supportive.
So that's also interesting when you think about work states and flow states, like you almost want to be relaxed and curious in because I know like whenever I'm in that like I prefer to not be like I'd rather be on the sitting on the ground and really enjoying reading and doing different things versus like hunched over in a little chair and a desk. Um, Curiosity is very helpful, you think, to get into those type of states of mind where you can learn more and do more work.
Yeah, I think of curiosity as a flow accelerant.
Hmm. Yeah.
So, so
Gas
there are
pedal.
flow inhibitors and flow accelerants.
Okay.
And if you look at, maybe we do a podcast on flow sometime. That would be fun.
Yeah. That'd be an
But
interesting article.
the one liner on that is, Csikszentmihalyi talks about losing a sense of self. We're lost in the process.
Yes.
And so if you think of that contraction as a marker of self, right? Because anxiety says, oh,
Mm.
here I am and I'm feeling anxious. When we lose a sense of self, we're so expanded that we've lost that boundary.
Hmm.
So I would say that's very consistent. And curiosity is a great way to help us open up, suggesting that it would be a good flow accelerant.
So also, I'm curious again. When I'm like doing like text messaging and stuff, some of my favorite, like if I'm really excited about something, because we have a little family clan one, called the Marbles Clan with all of our adult children and their significant others. They're all in there and we're doing whatever, harassing them mostly. But my favorite emoji is the two little eyeballs and they're like big and they're looking to the side, because that really conveys what I'm trying to say. I just thought of that. I was like, wow, that there was actually an emoji that's like
Oh,
like what did I just say? What? You know?
oh.
So I find that interesting. Do you feel like even seeing that? Because when I see someone print, texting that emoji or that, it also brings me in, draws me into like, ooh, what's going on here? So just
Uh,
curious about just seeing it in an
yeah,
illustrative form.
I think it depends on what people have associated with certain emojis.
Oh,
So
interesting.
I would say if people train themselves to see that as a curiosity emoji, then
Mm.
absolutely.
Interesting. It's context driven. And what are
Yes.
you conveying? Oh, very interesting correlation. Very cool. Okay. So walk us through, if you wouldn't mind, briefly before we finish, unless there's other things you'd like to share. Just you have an entire protocol, not entire, like a big protocol. It's just like these little, like four little, uh, you call it the 10-second anxiety resets. So
Yeah.
it's not that nothing big, guys, but definitely something you can do. Can you walk us through that?
Sure. So the first is to notice whatever our emotion is and name it. So that's number one, name it. So for example, if we're stressed or anxious, name it. Oh, that's it's hard for me to do it without being curious. Oh, oh, that's anxiety, right?
Oh.
And then we can, if we're anxious, check number two is check our eyes. So when we're
Hmm.
anxious, when we're frustrated, tend to be narrow, as we've talked about. So just check to see what's our eye position. And then we can, number three is deliberately open our eyes. Oh,
I feel feel people need to watch this one on YouTube, guys, because this is very different than hearing it. But yes. Oh,
Yeah. And number 4, and I just put this in arbitrarily. It's not based on a randomized controlled trial that we did or anything.
yeah.
But number 4, I say hold and observe. So hold that position. Okay, you and I are going to do this together. We're going to hold this
Okay.
for 10 seconds. Ready?
Oh my gosh.
So ready? Go. 1, 2, 3, 4, 5, 6. Keep them wide. 8. I can't even count. I think I skipped number 7. Anyway, that was so notice what
That
it
was
feels
fun.
like when you keep your eyes wide open for even try to do it for 10 seconds. I mean, 5 seconds is probably plenty. I
Oh,
couldn't even count after 6 seconds. So that
my
was,
next thought was like, can I blink? Keep my eyes wide open. Uh, okay. Oh
uh,
my gosh, that is funny. No, it's hard. Well, it's hard to even just say, oh, oh, that's anxiety with that. Oh, like,
okay.
oh, only comes with the eyes, the eyebrows raising, the eyes getting bigger. And it's interesting. It just made me think about, because tonight I do a coaching group and it's called Culinary Healing, and I partnered with a friend of mine, Chef Martin Oswald, who's also on Face or Substack. You guys check; he's got some amazing stuff. He lives in Austria, but we're talking about blood sugar regulation, and we often use like a CGM, and people almost have a little bit of anxiety before they even check their blood sugars. And
Mm.
I was like, interesting, if they feel that and they know, they're like, oh, that's
Oh,
blood sugar anxiety. I'm going to walk into this like you curiosity. It's like
what's my
almost,
blood sugar?
yeah, like, or, oh, one that's my blood pressure. One of those type of situations. I'm going to use this little trick with them tonight and see what they think. This is going to actually be a lot of fun.
I would love to see a primary care physician do a study with people getting their blood pressure taken in a primary care setting, where
Yeah.
one, I had an old colleague at UMass who did a big study showing that one, people don't take blood pressure like they're supposed to, you're supposed to sit for 5 minutes, not look at your phone, all these
Yep.
things. That
Yep.
never happens.
Right.
And so, 2, imagine if we could just have a white coat reset where it's just
Right?
like when you're sitting down to get your blood pressure taken, there's a poster on the opposite wall that says, open your eyes really wide. And I could see the control group being, just check to see what your eyes are doing right now. It'd be really
Right.
interesting to see if you could drop blood pressure by a couple of points just by
Well,
having people do that before they get the cuff put on their arm.
well, it does make you wonder, and also you're just again reassociating. Walking into the doctor's office, you're already like this. It's kind of like we went and got our blood drawn because I'm doing those Whoop advanced labs because I'm
Okay.
curious. Again, it's one of those
Oh,
things. So it's very fascinating. But anyway, you walk into there, you're just like already like, oh, I gotta get my blood drawn. You can feel yourself. But I think people like they've already identified themselves as white coat hypertension. Like I just get hypertension walking into the doctor's office.
yep.
Well, yeah, if you say you are, you will. And
Yep.
so, what do you want me to do? Even when I'm visiting with them telemedicine, they'll say, oh my goodness, Dr. Marbertine, my white coat syndrome. I'm like, enough of this. I'm going to tell them before you click enter onto the telemedicine or whatever. It's like, oh, I'm feeling a little white coat apprehension. Maybe I'm going to, oh, I see that. I'm going to take some breaths. It's going to be okay. Anyway, I kind of got silly, but it's fun. This is great. I love this. Any final words you'd like to share?
Oh,
Oh,
that's it.
all right. Okay, guys. Go do some Oing and raise your eyebrows and let us know what you guys think. I'm Dr. Lori Marvis. Now, if you've ever taken a multivitamin, you've probably assumed it's giving you everything that you need. But the truth is, most women's multivitamins are filled with nutrients that you're already getting from your food, while skipping the ones your body really needs to thrive. And that's where the For Her Essential System comes in. I co-created the For Her Essential System with Complement, a science-backed supplement system that provides the essential nutrients women need for optimal health. It's designed to support hormonal balance, energy, bone health, and much more, with just the nutrients we struggle to get without the unnecessary fillers. What sets the For Her Essential System apart is that it is specifically formulated for women, with dosages based on the latest research, ensuring you get what you need, so you can thrive in everything you do, all day, every day. Now, to learn more and try it for yourself, visit the link in the description below and use the code for an exclusive discount. Take control of your health with the nutrients that matter most.